Hi, Tammy. Welcome to O'Shea Children's. I'm Courtney. I'm one of the lactation consultants and registered nurses here. How can I help you today?
Hi, thanks for having me. I'm 6 months pregnant and I'm on the fence about breastfeeding. I have a few reservations and I was wondering if you could explain it a little bit better for me.
Absolutely. Breastfeeding is an awesome journey to begin. I'm really thrilled that you're here talking to me.
Thanks.
Some of those great benefits of breastfeeding really involve you and your baby. Your baby will have a reduced risk of ear infections and GI disease and even respiratory illnesses. When you provide breast milk to your baby, that actually reduces their rate of obesity and diabetes later on in life. Childhood cancers are lower, and it also decreases their risk of SIDS, which is sudden infant death syndrome. For you, the benefits are extensive as well. You have a lower risk of breast cancer, ovarian cancer, and even endometrial cancer. Your risk of obesity and diabetes is actually lower as well. Moms benefit from a decreased risk of postpartum depression with breastfeeding, right?
That's good.
So there's a lot that really can be benefited from by breastfeeding. We're here to help you. Any other questions?
How do I start? Like, is there a way to prepare before I come to the hospital? Is there something I can do to, get a jump start on this whole
Absolutely.
journey?
There's a lot of great information out there. It's kind of confusing when you're looking around and you want to find the right resources. We're here to help you. Many of the hospitals have lactation consultants that you could give a call to. If you wanted to take some prenatal education, like a childbirth class, specifically a breastfeeding class would be wonderful. There's some places at the hospitals that do that. There's Care Connection, Baby Sweet Beginnings, even WIC offers prenatal education, so you can get a lot of great information from them. You can also look into different websites, just make sure they're reputable. Something like the American Academy of Pediatrics is great. You can read a book like The Womanly Art of Breastfeeding. That can give you some great tips as well.
So I can even call you before I even have the baby?
You absolutely can.
Good to know.
Yeah.
So am I allowed to give a bottle, or do I have to just exclusively breastfeed?
Well, we want to do what you want to do. So you let us know what your feeding plan is and we'll do our best to get you there. If you're looking at exclusively breastfeeding, we want you to get off to the best start. So learning about breastfeeding would come number one. And then when you get to the hospital, after labor and delivery, and you have this little bundle in your arms, I would encourage you to do lots of skin to skin. There's so many benefits to skin. It helps to regulate their body after delivery. Their blood sugars are elevated by being skin to skin. And plus with that proximity, they're able to start breastfeeding pretty well. They don't always, breastfeed perfectly in the beginning. It takes lots and lots of practice, which there's lots and lots of feedings in the beginning. So learning your baby, learning feeding cues, they tell you when they're hungry. That's their communication, and it's before crying. So if they're doing something like moving their hands towards their face, or if you touch their cheek and they're trying to eat your finger, that's actually a sign that they're hungry and you want to put them to breast. They may feed anywhere from 8 to 12 times a day, or even more during cluster feeding times. That's really common, especially in the evening and nighttime hours. Your nurses are available to help you. Here at O'Shea, we are baby friendly, which means all of our staff is educated in the basics of breastfeeding and how to help our mothers. We also have lactation consultants on staff day and night. So if you're running into an issue that one of your nurses can't help you with, we can step in and take over, whether it's a tongue tie or flat nipples, or even starting some breast pumping for a NICU baby.
Is there a cutoff for the best time, like the amount of time you should breastfeed before you switch to a bottle, if that was a choice of mine?
Right.
Like
well,
a minimum?
Yeah, absolutely. So in the beginning, you do have small amounts of breast milk. That's called colostrum, but your baby's belly is really little too. So many moms think they don't have enough, when in fact it's the perfect milk for a newborn. In about 3 to 5 days after delivery, your body responds by increasing that supply, and that's your mature breast milk. We really want you to limit the exposure of bottles or pacifiers until you are really well established with breastfeeding, typically around 1 month of age. The reason for that is just, it's very confusing for babies sometimes to learn this new skill and then learn something else like a bottle nipple. So if they get breastfeeding under control and can learn that really well, they're actually going to be able to bottle feed better around 1 month of age, and they won't be as confused. During that time, you can also start breast pumping. I know you had mentioned previously that you were going back to work.
Yes.
Right?
I'm a little nervous about that.
A
I don't
lot
know
of
how I'm going to
moms
do
are.
that.
Yeah, and that's kind of a scary thing to think about in the future. We do prepare moms for that by introducing some breast pumping around that 1 month of age, or earlier, unfortunately, if you have to go back earlier. So give yourself at least a good 2 weeks before you go back to start some breast pumping.
Okay.
You can start in the early morning. Usually you have a higher milk level overnight. So you would feed your baby first and then do some about 15 minutes, 20 minutes of breast pumping afterwards. Some moms won't see a lot right away, right? But the golden rule of breast milk production is the more you try to take out, the more you make. So by doing that extra pumping, you're actually gradually increasing your supply.
Oh.
Okay, so you can put that in the fridge. Okay, even if it's very small amounts, you can collect that. It's about 6 days in the fridge. And then if you have a fridge freezer, if you're saving milk, it'll be about 6 months in the freezer. Okay. And then when you're ready to use that breast milk, you can just thaw it in some lukewarm water. Maybe you have someone else doing the feeding, like dad or a partner or a grandparent. They can step in and do that first bottle feed for you.
So no microwaves?
No microwaves, no. That can actually kill the good stuff in breast milk that we want to give to your baby, and it also can cause hot spots.
Okay,
Mhm.
Perfect, good to know. So you're giving me all this help while we're in the hospital. What happens when I get home and I just am overwhelmed and can't handle it? What do I do? And I don't want to give up.
Absolutely, and we wouldn't want you to. So there are some great resources, especially in the Western New York area. We usually, in most hospitals in this area, will give you information on breastfeeding. And for many questions, the information is right there. So definitely take a look through your discharge paperwork. Sometimes you'll find an easy answer. If it's not there, here at Oshai, we do give you a resource list. It has phone numbers, places you can go to for support and some help and some questions. They include your pediatrician, your OBGYN, WIC has breastfeeding peer counselors to help in those situations. Again, Care Connection, Baby Sweet Beginnings, great places to go to. If you wanted something immediately, we actually have baby cafes that are in the area, and they are during the days of the week at certain times. Oshai also has a baby cafe every Wednesday from 11:30 till 1. It's virtual right now, like most things are, but you can join us. We can help you with breastfeeding, any questions you have. If that time period doesn't work for you, there are other baby cafes in the area. You can just go to www.babycafe.usa.org, that was it, and they will give you the information on where you can go.
Oh, that's very helpful. Thank you so much for your time.
You're welcome.
Have a great day.